Namaste students, myself Dr. Swathi KS, Assistant Professor, Department of RASASHASTRA and BHAISHAJYA KALPANA, JAYOTI VIDYAPEETH Women's University, Jaipur. So today we deal regarding the topic of the suppositories, Varti Kalpana. So suppositories, coming to the introduction, the suppositories are the solid dosage forms of medicament for the insertion into the body cavities other than the mouth. So they are inserted into the rectum, vagina or nasal cavity. The product is formulated in such a way that they melt, soften or dissolve and exert localized or systemic effects. So coming to the advantages, so these are easily administered to the children, old person and to the unconscious patients who cannot swallow the drug easily. So they are inserted in the rectum to exert a direct and rapid action on rectum and to promote evacuation of the bowel. So it is a convenient mode of administration of drug which irritates GIT and causes vomiting and destroy in the acidic pH of the gastric juice of stomach. So drugs in suppositories are slowly absorbed, giving sustained action. Coming to the disadvantages, irritant drugs can't be administered by this route and it is not suitable for the patients who are suffering from the diarrhea and the problem of the patient acceptability and incomplete absorption may be obtained because suppository usually promotes evacuation of the bowel. So coming to the types, rectal suppositories. So it is used for the adults weighing 2 grams and are torpedo shaped, and children suppositories weigh about 1 gram. Vaginal suppositories or pessaries, it's weigh about 3 to 5 grams and are molded into globular or oviform shape or compressed on a tablet press in the conical shapes. Nasal suppositories, it's also called as nasal bogies or buginaria and meant for introducing into the nasal cavity. And they are prepared with the glycerogelatin base and they weigh about 1 grams and the length is 9 to 10 centimeter. Next, urethral suppositories are called bogies. They are thin, long, cylindrical shape, rounded at one end, and those intended for male weigh 4 grams each and are 100 to 150 mm long, and those for females are 2 grams each and 60 to 70 mm in length. Ear cones, also called orinaria, and meant for introduction into the introduced into the ear, and it's are rarely used. And theobroma oil is used as base and prepared in urethral bogies, mold and cut according to the size. The new trends of suppositories are tablet suppositories, layered suppositories, capsule suppositories, coated suppositories, and disposable molds. So coming to the suppository base, so ideal suppository base, it should melt at body temperature or dissolve in body fluids, should be non-toxic and non-irritant. It should be compatible with any medicament and releases any medicament readily and easily molded and removed from the mold, stable to heating above the melting point, easy to handle and stable on storage. So classification of the bases. First one is the fatty bases that is designed to melt at body temperature, like theobroma oil, cocoa butter, emulsified theobroma oil, hydrogenated oils comes under the fatty bases. Second, water soluble and water miscible base like glycerogelatin base, polyethylene and polyethylene glycol, soap, glycerin suppositories comes under the water soluble. So coming to the preparation of suppositories, so there are 4 methods, like first one is the rolling method, next compression molding, next pour molding and automatic molding machines. So rolling method is useful when we prepare a small number of suppositories and the drug is made into fine powder and it is incorporated into the suppository base by kneading with it or by triturating in a mortar. The kneaded mass is rolled between fingers into rod-shaped units and the rods are cut into pieces and then one end is pointed. So compression molding, the cold mass of the base containing the drug is compressed into suppositories using a hand-operated machine. Next, the pour molding. Uh, Using the suppository mold, which is made of metal or plastic, like traditional metal molds are in two halves, which are clamped together with a screw. So steps like the base is melted and precautions are taken not to overheat it. The drugs is incorporated in it, and the molten liquid mass is poured into a chilled, lubricated with a cocoa butter or glycerol gelatin as a base mold. And after solidification, the cone-shaped suppositories are obtained. So lubricating the cavities of the mold is helpful in producing elegant suppositories and free from surface depression. The lubricant should be applied on a pledgelet of a gauze or with fairly stiff brush, um, and automatic molding machine. So all the operations in pour molding are done by automatic machines. Using this machine, uh, up up to like about 10,000 suppositories per hour can be produced. So packing and come to the packing and storage. Suppositories are usually packed in tin or aluminum, paper, or plastic. Poorly packed suppositories may give rise to staining, breakage, or deformation by melting, and both cocoa butter and glycerinated gelatin suppositories stored preferably in refrigerators, and polyethylene glycol supposed to be stored at usual room temperature without the requirement of the refrigerator. So this is regarding the today's topic, suppositories. So if any queries, please mention in the comment box so that I can resolve it. Thank you.